So I'm Zulfi Bhutta from the Center for Global Child Health at SickKids and the Aga Khan University. So I want to talk to you today about the global challenge of maternal and child mortality, specifically focusing on not just the numbers, but what lies behind the numbers. So as we speak, close to around 270,000 women die every year during or around the period of childbirth as a result of complications that are directly related to being pregnant. And in addition, close to 6.5 million children die every year under 5 years of age. What do most of these women and children die of? They die of preventable disorders, things that have been controlled, eliminated from much of the developed world. So for example, in many parts of the world where women are malnourished, have multiple pregnancies, especially if pregnancies start early in adolescent girls, young girls, they start pregnancy with a major disadvantage of not only being wasted, but at times with severe anemia. And there, a simple complication in pregnancy that places them at great risk of dying can also lead to that untowards outcome at some stage therein. So many of these deaths because of bleeding during the process of childbirth or afterwards, hemorrhage as it's called, are much worse if you start off with moderate to severe anemia. Similarly, we know that many complications of pregnancy which are detected by routine antenatal care, checkups and preventive care that's so common in much of the developed world, are not picked up very simply because women do not have access to preventive services or antenatal care. There is also a clustering of maternal deaths in and around the period of childbirth, which is recognized as the period at greatest risk of dying. And some of that is related to the risk of hemorrhage that I alluded to, but some of it is also related to the risk of having obstructed labor and not having access to skilled care that could potentially address the issue of obstructed labor through instrumental or delivery or cesarean section. Those things which are taken for granted in referral systems, where if you had a complication and could go to a higher level of care into the hands of skilled attendants, cannot be taken for granted in many countries which have poor facilities and, importantly, lack of access to care in those facilities. But we do recognize that in any event, the link between maternal health and child health is largely through the influence of maternal health on newborn outcomes. Now, newborns by definition are babies who are under 4 weeks of age, and their health is so intimately intertwined with the health of the mother that you have to take both together when you are looking at risk factors and interventions. How important is newborn health to child health in general? You can gauge this by the simple statistic that close to 44% of all under 5 deaths occur in those first 4 weeks of life. And if you were to take even a smaller slice, take the first 2 or 3 days of life, then 3/4 of all newborn deaths are in that period. Almost half of all newborn deaths are in the first 24 hours of birth, during the process of childbirth. So if you take the maternal deaths and newborn deaths together, that period of in and around childbirth is the period of greatest risk. You can also understand some of the killers, the major killers of newborn babies being closely related to maternal health, and by that measure, interventions related to maternal health. So we believe that between asphyxia or intrapartum complications, prematurity, and a major chunk of what kills newborn babies related to infections, we have almost 85% of the total burden of newborn mortality worldwide. And the importance of knowing these disaggregated figures is that without this information, you really cannot develop interventions and make solutions.